In the top stories, 6th COVID-related death recorded in the Federation. 50 bus drivers in St. Lucia test positive for COVID-19. And more than 100 people dead in 2 weeks by dengue outbreak in India. Hello and welcome to the ZIZ Midday Newscast. Today is Friday, September 10th, 2021. I'm your presenter, Shanique Harvey. Nationally, a 6th person has died from COVID-19 in the Federation. This is according to the Ministry of Health in the situation report for Thursday made available at 11:30 p.m. This death comes 1 week after the 5th. Officials continue to urge everyone to get vaccinated, as this is the most effective way to prevent severe illness or death related to COVID-19. The St. Christopher Air and Seaports Authority, or SCASPA, and the government of St. Kitts by extension were granted arbitration award in the case relating to the second cruise pier at Port Zante. The contractor initiated arbitration against SCASPA in 2019 over unpaid claims of US $15.2 million, which equates to over EC $41 million. SCASPA's acting chief executive officer, Tafida Stewart, said that a decision was rendered in June 2021. Ms. Stewart stated on Wednesday's edition of Working for You that, quote, the tribunal ruled that the claims, most of them were null and void. The contractor claimed US $1.5 million related directly to the contract work. Other claims ranged from loading and offloading, additional dredge work, additional piling, and cost increases during the process. Claims were also made for exceptional adverse weather conditions, as well as utilities and more. She said the tribunal ruling was overwhelmingly in favor of SCASPA.
SCASPA is only liable to pay $294,000 in losses arising from adverse weather conditions. And of course, the $1.5 million that I spoke about initially, which related to the contract itself, that amount had to be paid. So out of the $15 million, SCASPA simply had to pay $294,000. Now, on top of that, because the pier was completed later than expected, it was supposed to be completed in September, we took it over in December. The tribunal awarded damages, delayed damages to SCASPA, and so the contractor has to pay to SCASPA $624,000 US.
The acting CEO expressed pleasure with the arbitration decision. She indicated that while there are several minor repairs to be carried out at the second cruise pier, they do not impact the capability of the pier to accommodate Oasis-class vessels. The recent delays and late dissemination of information reflected on the daily COVID-19 dashboard has become an issue for members of the general public, an issue health officials admit is due to the constant confirmation of results on samples tested. On Wednesday, Dr. Cameron Wilkinson, Medical Chief of Staff at the JNF General Hospital, explained the process of gathering the information.
We have two dashboards, one that displays the vaccination status and the other for the positive cases, deaths, etc. Now, as it relates to the vaccination dashboard, the vaccination program has expanded, and we have to collect information from 11 health centers across St. Kitts and 6 in Nevis. The information is tabulated at the Newtown Health Center, and it's sent to the CMO's office for verification before it goes off on the dashboards. When the health centers close at 5, there is a lot more work involved in getting the information together. Previously, we would have had the information for you, for example, on the vaccination status at a briefing like this. But while the CMO was presenting, we got the information. And this comes once you have an increased volume of work.
The medical chief of staff stated that information is constantly being updated, citing reports by the CMO stating one thing at the NEOC weekly briefings and the dashboards after showing different statistics. He indicated that any delay in the daily case count dashboard would be mainly due to the number of tests being conducted in this third wave.
As it relates to the one that displays the positive cases, there's a greater volume of testing that has to be done. For example, yesterday we had 30 plus positive cases, and so with the contact tracing that had to be done today, one case might have 20, 30 contacts, and so you can see the volume of testing that has to be done on a daily basis. When the information goes to the lab, from the time the test goes on the machine, it takes 3+ hours before it comes off, and they are ran in batches. So we may at 6 o'clock get back results that might just show 3 or 4 or 5 positive cases, but when the final batches are released, sometimes we get the information back at 10, 11 o'clock, and you might have 20-something positive cases there.
With this in mind, Dr. Wilkinson said the information is now disseminated at 10 or 11 p.m. to represent the most accurate results for the preceding 24-hour period. In regional news, in St. Lucia, 50 bus drivers have tested positive for COVID-19. The National Council on Public Transportation says a meeting with health officials is scheduled for Friday to discuss the growing impact of the fourth wave on the transportation sector. More in this HTS News report.
The situation has not gotten better. As a matter of fact, we are faced with some new challenges, and I think we need to take a different approach to the sector as a whole.
A worsening situation for the vulnerable transportation sector, heavily impacted by a plague of COVID-19 cases. First Vice President and COPT, Kentry Frederick, says the escalating situation has taken a massive toll on the sector as more members continue to test positive for the virus.
Right now, we must admit we have close to 50 operators that are infected with COVID. We must give those figures. We must let persons know that when you are boarding a bus, begin to think. It's not about being infected by the driver, but also persons who are coming on the bus to do that.
The council has formulated contingency plans if the current situation is further exacerbated.
If it gets to the worst stage where we're looking at the breaking point, more than likely we would have to withdraw our service, given written notice to the Ministry of Transport, hopefully 7 to 14 days, and then withdraw the buses, at least to save the lives of our drivers.
Frederick cautions operators who have been knowingly placing their lives and the lives of others on the line to secure their livelihoods that there may be a heavy price to pay if they are found wanting.
And finally, in regional news, in Antigua and Barbuda, students will begin learning remotely next week, but will have to wait at least another 3 weeks to return to the physical classroom. ABS's Ursula Charles Jr. reports.
While teachers have already returned to schools, the date for students' physical return has been rescheduled. Originally planned for September 6, then postponed to September 13, yet another extension has become necessary. So says Minister for Information, the Honorable Melford Nicholas.
Based on all of the discussions that we've had with the senior education officials, Ministry of Health and the health officials, and of course the union officials as well, the Cabinet made a determination that schools will resume on Monday, but that the face-to-face classes will be delayed by a further 3 weeks to commence on 4th of October, subject to the prevailing conditions and, of course, the number of persons who would come forward and get vaccinated at the time.
To date, there is encouraging news to report on the uptake of the Pfizer-BioNTech vaccine by students.
On a visit that I made to the multipurpose center on Monday, it was clear to me that there has been a flurry of activity, certainly amongst the young population. The Minister of Health yesterday did indicate that some 1,500 students have so far come forward to take the vaccination.
Online classes will begin Monday, September 13, but Cabinet is hopeful the next 3 weeks provide an ample time frame for as many other students and teachers as possible to get vaccinated.
Schools are to be reopened on the 13th of September for online classes until the 4th of October 2021. That 3-week window will give the Ministry of Health and the Ministry of Education sufficient time to vaccinate as many other students between that 12 to 18-year category.
Grade 1 and Form 1 students may be invited to school plants for orientation next week. Those schedules will be set by individual school administrations. For ABS News, I'm Ursil Charles.
Internationally, a serious outbreak of dengue fever has taken hold in India's most populous state of Uttar Pradesh. More than 100 people, many of them children, are known to have died in the past 2 weeks. Al Jazeera's correspondent Elizabeth Paranam reports.
Desperate parents carry their children to this hospital in Firozabad in Uttar Pradesh state. For the past 2 weeks, it has been inundated with children suffering from high temperatures and other symptoms of dengue fever. Mohammad Azim's 6-month-old daughter Anya has tested positive for the mosquito-borne virus. He says his 3-year-old nephew Atif has also been unwell.
She has had a fever for several days and has been taking medicines. When her condition didn't improve, I brought her here, but it took more than 3 hours for them to look at her. It is difficult for a common man to have access to doctors here.
Most of those who have died from dengue fever in the past 2 weeks are children.
Definitely patients are coming here. Most are in the pediatric age group and all are presenting, maximum patients are presenting with fever, diarrhea, dysentery, abdominal pain.
Cases of the virus usually rise during the monsoon season in tropical climates, but health officials say the outbreak is particularly bad this year. Municipal workers are spraying chemicals to kill mosquitoes in the Sundarmanagar neighborhood. Pushpendra lost his 6-year-old son Krishna to the dengue virus.
There are a lot of children who are sick in our neighborhood. Some have dengue, some have fever. Half of the children from here are in hospital. Just recently, a child right opposite our house was admitted. 2 children who lived around us have died.
Dengue is transmitted by mosquitoes which breed in and around stagnant water.
In many parts of Firozabad, people live next to open drains, and in more than 1/3 of homes in Indian cities, wastewater is released from the house through an open drainage system.
Health experts say the drains are a breeding ground for diseases, but that spraying isn't a long-term solution. They say the government needs to do more. Firozabad's chief medical officer told Al Jazeera the worst of the outbreak is over, but that wasn't the picture at the city's biggest children's hospital. Elizabeth Puranam, Al Jazeera, Firozabad, Uttar Pradesh.
Los Angeles County school officials ordered COVID-19 vaccinations for all students aged 12 and over on Thursday, the largest school district in the United States to take that dramatic step. More in this Reuters report.
The item passes.
Thank you.
School officials in Los Angeles County ordered vaccines for students 12 and up in a unanimous vote on Thursday. LA County is the largest school district in the country to mandate shots, and the orders will apply to more than 600,000 students. That's despite angry objections from several parents who said they were worried about the safety of vaccines and that they had the right to make the decision for their children. Interim Superintendent Megan Riley spoke after the vote.
As the second largest district in the country with a richly diverse student population, we know the impact and experiences with COVID-19 are varied, and that there are different levels of comfort and discomfort with the vaccine and other COVID-related safety measures. We recognize this. But along with these truths, our charge remains clear: to provide students with the best education possible, which includes the many benefits of in-person education. The science is clear.
Almost 3/4 of the district's students are Latino. Board members have noted a distrust in the government among immigrant parents who had concerns over vaccine safety, though they said they would make efforts to convince them otherwise. Thursday's decision will not affect a minority of students in LA County who have opted to remain home. Exemptions can also be made for medical or religious reasons. The board had previously ordered all staff be inoculated.
And now for the weather. Present weather is fair skies with a gentle breeze of 12 miles per hour from an easterly direction. Seas are 1.2 to 1.8 meters or 4 to 6 feet. Weather forecast for St. Kitts and Nevis for today and tonight will be partly cloudy with a 30% or low chance of showers. Sunset today will be at 6:18 p.m. and sunrise tomorrow at 5:58 a.m. And that brings us to the end of the ZIZ Midday Newscast. Join us this evening for these stories and more in detail. Thank you for tuning in. I'm your presenter, Shanique Harvey.